Well, hi everybody. My name is Ginny Williams and I'm the CEO for Curry Health Network. And if you're tuning in tonight, I just want to thank you for joining me and spending the evening with me. As I did last week, I've got some general information I want to share with you all before I turn my attention to the questions that were submitted earlier this week. And thank you all for submitting those. This week a little bit differently. I'm going to actually read the questions and answer them directly, but I'll do that after I go over some general information. Also, this week I have some notes that I want to refer to because I have some statistics and things that I want to make sure I don't forget or I don't misquote. So if I look down from the camera, I apologize for that. First, I want to start off this evening by saying we have definitely heard the community loud and clear expressing frustration that Curry Health Network during this pandemic is forced to implement a cost reduction plan that includes employees and providers. And I want to tell you that I too am extremely frustrated with that. But until such time as healthcare reform takes place in this country and hospitals are not paid on their volumes, most hospitals are finding themselves, or not most, but many, in the same situation that we are in. And I think it's really important to emphasize that Curry Health Network is not in a unique situation. And to that end, I have a few quotes from some recent articles that were published that demonstrate exactly what I'm saying. So let me start out by saying the Oregonian on April 9th published this information. It states that the Oregon Clinic has furloughed about 820 employees. The Portland Clinic, another physician-owned chain, furloughed 180 employees, and they cut the pay and hours of 250 others earlier this week. The Oregon Clinic's doctors have taken 50% pay cuts, Jameson went on to say, and they are considering more, reducing salaries to $3,000 to $4,000 a month for physicians. The Portland Clinic doctors took a 20 to 30% pay reduction in April and will do so again in May. Another article that was published on April 7th from the Willamette Week stated that as of last week, more than 9,500 healthcare and social assistance sector workers are seeking benefits after losing their jobs. And the last quote I have is from an attorney in California who counsels physicians nationwide about employment contracts. And he goes on to say that in all parts of the country, physicians are being asked to sign agreements or acknowledgments for pay cuts ranging from 20 to 75%, depending on what their specialty is, where they are, and what the institutions are doing. And again, the decisions that we're making related to our cost expenses are directly proportionate to the reduction in volumes, and I want to share some of those statistics with you as well. In the first 15 days of April, the office visits seen at the Brookings Clinic on 5th Street in Brookings are down 45% from the fiscal year 19 average daily number of visits. Our emergency room visits are down 40% from averages over the last year. Our clinic here in Gold Beach is down 60% in the number of visits that it's seeing. We're seeing that our lab walk-in services are down another 30%, and our outpatient surgery has been down 70%. These are just for the first 15 days of April. And last but not least, our outpatient radiology exams are down 50%. And if any of you have been tuning in to board meetings over the last year and a half, and strategically when we look at our budgets and where we drive revenue, it is from these areas, specifically radiology, lab, and surgery, that drive our revenue. These reductions in these volumes are just not sustainable and leaving everybody employed to the level that we were. I also want to go on to explain that although there is extreme frustration in the decisions that were made about our primary care providers, I want to reemphasize with you that all three of our primary care providers were offered alternate contracts, as were all of the other physicians that are remaining with Curry Health Network. But Dr. Nelson, Sarah Dickerson, and Howard Croy, for personal reasons, chose not to accept an alternate contract. And in some circumstances, one circumstance, we even offered to deploy an individual into other sectors of the healthcare, whether working on med-surg or in the ER or as a house supervisor, and those were declined. But these are the very things that other health systems and hospitals are doing across the nation, is repurposing their workforce so that they can remain here in the event of a surge. So unfortunately, those are the facts. And I do want to also point out that last week I did not have a list of the providers that remain with our network, but I think it's important for you to know who does remain with our network and what they are doing. I'm going to start out with Dr. Amsden, who is a pain specialist. He continues with his normal contract. So if you need to seek services for chronic pain, Dr. Amsden is standing by, willing and ready and able to assist you. Dr. Beatty, our OBGYN, he did accept an altered contract by where he is just working per the demands of clinic office requests. So if you have an OBGYN need, please know that Dr. Beatty is here for you for those circumstances. Dr. Carlson does remain in a full-time capacity as our general surgeon and is providing ER coverage call for general surgery purposes. Dr. Harris remains with the organization on a per diem contract. Dr. Lewis and Dr. Mayer are urologists. They have offered to work for a period of time pro bono. And I have to say, without their willingness to do that, Curry Health Network would not have been able to afford their specialty contracts either. Dr. Lauder, primary care and OB services, she is working full-time in Gold Beach Monday through Thursday. And Dr. Manueli continues in a per diem capacity, and he has been seeing patients as his schedule is demanding. And we're looking forward to having him join Curry Health Network's primary care services here in Gold Beach on Fridays in the future. Dr. Michaelis is our interventional radiologist. She continues to work 3 days a week, providing radiology services for those that are necessary. Dr. Pitchford continues to provide services 4 days a week up in Port Orford, but he has been reduced to a half-time status, and that was a mutual agreement between he and the organization. We continue to employ full-time 2 CRNAs, Laura Travati and Leah Morris, and Matt Morris, our 3rd CRNA, is on a per diem contract should surgical volumes allow us to reopen our surgery department. MCare, who is the contracted provider for our emergency room, has continued to provide emergency room physicians with no interruptions to service. The Rural Physicians Group, who is the contracted service that we utilize for our hospitalists, also continue to provide full-time coverage to the hospital with no interruptions. In addition to those that I mentioned earlier, Brahms Patel, Karen Morrow, Kim Hanks, and Kelly Creaser remain working full-time down at CMC, and they are accepting and seeing all patients as you're required or requesting appointments. In addition, Marcia Rickert is working in a per diem status, and Kalani Baker continues to be employed by the organization. I'm proud to announce that joining our organization in June is Jackie Michaels Havens. She is a family nurse practitioner. She specializes in psychiatric and pediatrics, but also will be joining our primary care team. And in the fall of 2020, Dr. Brantingham, a podiatrist, will be joining our team to cover orthopedic needs from the ankle, or actually I should say from the knee down. We continued discussions with practices from the north and the east for orthopedics and cardiology, and I'm very confident that we'll be able to meet our needs of our community with their partnership once they return to business as usual. I want to emphasize that our outpatient nursing services, including infusions such as antibiotics or blood products, Coumadin, and wound care, continue 2 days a week, both in Brookings and here in Gold Beach. Obviously, Brookings doesn't allow for us to provide all of the infusion services because we don't have a pharmacy on site down there, but those services that were previously offered continue to be offered, and they are looking forward to serving you if you have such a need. I want to mention also that telehealth services, we started offering that about 2 weeks ago, and we're seeing on average about 9 visits a day. Those visits are established based on patient need and our provider's input. So if a provider feels that it's not necessary for you to come into the clinic, they will ask that we schedule a telehealth visit. That allows you to remain at home and still able to see your provider if necessary. We had a question related to refills and for medications, and I want to emphasize, if you have a need for a refill for a medication, please call our scheduling, our patient access center at 541-247-2000. Sorry, that number, I didn't write that down right. I'll make sure that we get that number. But our Patient Access Center is able to handle refill requests for anybody in need. And I will get that phone number before we get off the live stream here. I want to move on and talk about another topic, which is surge plans. Curry Health Network has been intimately involved with a surge plan should we see an increased need for hospitalized patients with or without COVID symptoms. The plan is a multi-component plan that allows us to activate certain components at certain times as necessary. The plan would allow Curry General Hospital to expand from 18 beds up to 47 beds if necessary. Obviously, if that were to occur, we would deploy all of our physicians, our respiratory therapists, our CRNAs, our nursing staff, and our support staff to care for those patients, and we could see a further decline in outpatient services if and when that ever happened. Our plan emphasizes your safety. It allows us to separate patients that have been either suspected or confirmed positive for COVID-19 from those that do not have that. We do have 6 ventilators within the organization, or actually 6 machines that can be used as ventilators. And we've been asked questions about, can those ventilators accommodate multiple patients? And we've heard in other parts of the country that that is being done, but that is a very clinical decision that is made by our medical team. And if necessary and able, our machines do allow us to do that. Personal protective equipment is part of this plan, and as you know, we are conserving the PPE in case of such a surge. And we want to thank everybody for donating the surgical gowns and other PPE and masks. We've had a great support for that. I think the supply that we are concerned most about are gloves in certain sizes. Those are the latex-free gloves. We've had a heck of a time getting size 7. Those are things we're making accommodations where people are wearing either a size too big or too small. I think it's important to realize too that today Curry Health Network received a 20 by 20 deluxe isolation unit. It's called a tent, but it's actually more like a mobile building. This isolation unit comes complete with an HVAC system that allows for climate control, and it allows us to regulate a negative and positive pressure throughout that. It provides an air scrubber and a HEPA filtration system. So essentially, air from inside that unit is sucked through the HEPA filtration system, scrubbed and cleaned, and released back out into the environment, not back into the tent. You will not see us put that tent up right now. It's part of a surge plan, either to be used perhaps for rapid screening if we were to need that, or if things really got out of hand, we could use it as a makeshift morgue, because we know we have limited services here in our community for that. But there's no need for us to stand that tent up right now. If you do see that we've erected it, it's just for practice purposes and so that we can familiarize ourselves with that tent. And we're grateful for receiving that. Again, that came from the National Guard today. I want to talk a bit about COVID testing. A lot of questions about that. To date, Curry Health Network has tested 91 individuals, and we have 4 pending test results that were taken yesterday. And in all of those, we've only had 1 positive return. Our turnaround time for these tests that we send out is approximately 3 to 4 days. But Curry Health Network was lucky, and we're grateful to have received the Abbott ID Now testing unit. But due to limited supplies, we've created some criteria by which we'll use these rapid tests, and I want to go over those criteria with you. We will only use those rapid tests for hospitalized patients suspected of COVID-19 with symptoms, for critical emergency room patients suspected of COVID that are going to require admission or transfer to another facility for a higher level of care, patients with a new onset of cough, fever, or shortness of breath, and are residing in a group environment, such as a group home or a skilled nursing facility or assisted living facility. We will test you rapidly for that, because we don't want to return you to that environment without being sure that you're not positive. We will use them on healthcare workers and our first responders who have been exposed to a high or medium risk situation, And lastly, we will use those for patients that we determine or we're aware of as being homeless. And the reason being, we don't want to turn somebody back out into the environment whereby it would be difficult for us to contact them in 3 or 4 days. I want to talk to you a bit about billing for COVID-19 services. When the governor initially announced that no patients would be billed for COVID-19 testing, we were very literal about that. But we've since learned that patients should not be billed and will not be billed for Curry Health Network for services even related to services that led up to the testing of COVID-19. And I want to say that early on we didn't understand that. And so if you have received a bill from Curry Health Network and have been tested for COVID-19, you can disregard that bill. We've already identified those individuals that may have received a bill, and we are adjusting those accounts accordingly. If you feel the need, please contact one of our financial counselors and they can assure that your account's been cleared. You do not owe anything for those services. If, however, you presented to Curry Health Network for a service that did not result in us testing you for COVID, you will receive a bill for those services, because only those bills directly resulting from a COVID-19 test will be included in that. So I've covered a lot of ground very quickly, as my nature. If you know me, I'm from New York, so I talk pretty fast. But at this point, I'd like to read the questions that were submitted this week. And again, for next week, if you have questions, just submit them to us really through any forum, and we will grab those. And tonight, though, I'm going to read them verbatim. I don't want anybody to think that I'm skirting a question or trying to avoid a question. So the first question I had was, I heard Asante was buying Curry Health Network. Sorry. I'm going to get rid of that. So I heard Asante was buying Curry Health Network, and I can tell you that I am not aware of any discussions by myself or anybody else with Asante that would suggest we are looking to be purchased or that they have an interest in purchasing us. The next question is a set of questions. I'm just going to read them collectively and then answer them. Why can't you pay full-time doctors? Why have you mismanaged the budget? How can I trust you when it's taken so long to find a doctor, then spend 4 months on a waiting list, and then you furloughed her? So angry you are playing with people's lives. Well, first of all, I want to apologize. It's not my intent for anybody to feel like I am playing with your lives. And these decisions, as I said, they have not been easy. As it would relate to compensating physicians, we use national benchmark data to establish salaries for our physicians, and they are competitively paid. As it would relate to mismanaging the budget, it is true, and I own the total responsibility that the management team put forward to the board a budget that would include us rapidly increasing services provided, and we were unable to accomplish those targets. That is my responsibility, and for that I apologize. Since then, opening Curry Medical Center and emergency room in Brookings, we've missed targets there as well. And so we have been writing our expenses and trying to understand why our revenue is significantly less for the same services down there than they are in Brookings. And that will be an ongoing topic with myself and the board in future meetings. But I think from the third part of that question is, how can you trust me after you've waited so long to get a primary healthcare provider? I think the whole healthcare industry is going to reevaluate how it provides healthcare. And I would say to you that right now we're using a team-based approach. If you need an appointment, if you have a question, if you need prescriptions refilled, please call 412-2000 and make that request known. We have providers that are willing to see you and your loved ones. And we have no intention of making you wait a day longer than is now. On what's transpiring in regards to services and allocations of doctors. What are we, chopped liver? Please, all I ask is for the facts about the situation. From Facebook book postings, we have no doctors here in Brookings. Please mail out vital information to residents of Brookings. So I think I've addressed that earlier. We do have physicians, we do have providers. They are still working at CMC, and they have capacity. If you have a need, please call 412-2000 and make your request known. Are we getting automatic referrals to new primary care physicians if ours have left? Why have there been no letters sent to us patients notifying us that our physician and others have left. So I confirmed with staff that we have been sending letters out for those patients that were previously being seen by Dr. Adams, and follow-up phone calls are in process right now. But again, we're not necessarily assigning you a new provider. We're making sure that your needs are being met in a timely manner. So if you have follow-up and you were one of Dr. Adams' patients, other providers are willing and able to see you and meet your needs. As it would relate to Dr. Nelson and Sarah Dickerson, we are in the process of putting letters together for you, and you should be receiving those in a couple of weeks. And again, we'll be using that team-based approach if you've had one of those providers that are no longer with the organization by their choice. Another question, testing results reported to who and when? Please clarify if Curry General is the only testing site in the county. Please consider reporting all tests conducted with positive, negative, and pending data. The difference in testing and reporting between Curry and Coos County need to be explained. It seems unlikely they would be testing that much more than we are. What I can tell you is we are following the Oregon Health Authority's guidelines, and individuals need to meet those guidelines. Early on in this, we had very limited number of tests, and we wanted to make sure that we were testing only those that met those requirements. I do anticipate the Oregon Health Authority will be revising their guidelines, and we will revise right along with them. I really cannot tell you why the testing differences of numbers between counties is so different. And I will tell you, we do report our numbers to our public health administrator on a daily basis. So Cherie knows exactly how many tests we performed, how many are pending, and certainly if we've received a positive result. And we report those actually to her Monday through Friday, and not every single day. Obviously, if we have any reported cases that are positive on the weekends, we will be notifying them. The next question, why were patients who have been described as asymptomatic tested, while members of our community with symptoms have been saying they've been refused COVID testing? What criteria are you using to decide who gets tested, and why isn't everybody being tested? Well, again, that goes back to the limited number of tests initially. We do have ample tests to test those that need to be tested, but again, we are following Oregon Health Authority's guidelines and not arbitrarily deciding who to be tested and who not to be tested. That is definitely a decision that is made by our physicians and our providers. So what are all the patients of the physicians that were let go, furloughed, or whatever you want to call it supposed to do? My doctor is Dr. Nelson, and I understand that she had been furloughed. Who can I see when I need care or need prescription refills? This is a disaster on top of a disaster. Please call 541-2000 to make an appointment or for your refill needs. As I said many times, we've got providers here that are willing and able to handle the patient volumes that we are currently seeing today. If Curry County had no COVID-19 until April 6th, why did Curry Health Network stop doing non-essential surgeries in early March and thereby damaging its financial stability and endangering the health of so many? Oregon has had very, very low count of COVID-19, yet CHN is all but shut down to the needs of our community. Well, I want to be clear on this. Curry Health Network did not make the decision to stop its voluntary services. The governor of our state demanded that we do so by an order on March 18th. She ordered an issue for folks to stay home, and she issued an order that no longer allowed any health systems or hospitals in the state to perform these elective procedures. So please be clear, that was not our choice. I will say that that decision was made in order to preserve the personal protection and equipment necessary so that if we saw a surge, we wouldn't be without masks, gloves, gowns, and other necessary equipment. So that was not our decision. We had another question about refills. Again, if you need a refill, please call us. We'll take care of that right away. Another individual asked, have I been tested? No, I haven't been tested. I haven't had any symptoms. I haven't required testing. And even if I wanted to be tested, they wouldn't test me because I wouldn't meet the requirements. So the second question of that was, how much are you paid? With my 20% reduction, I'm paid approximately $215,000 a year. And all of our management team has taken a voluntary reduction of that 20%, including myself. And then it goes on to say, have all of our staff been tested? And again, I would tell you, Our staff is being told if they have any symptoms, they are to stay home until they are clear of symptoms for at least 72 hours. And if they meet symptom requirements and require testing, we are there for them to do so. So that's it for the questions that were submitted. I want to make everybody aware that Curry Health Network, from the board of the directors to every single staff working with us, we are here for you. We want to take care of your needs. We also want to thank those that have showed love and appreciation by donating food and goodie bags and PPE. That appreciation, I have to express, is so necessary for our healthcare workers to continue to provide the services that they do. It makes them feel good, and I just appreciate all that everybody is doing to help us through these very difficult times. So tonight, I hope I've answered some of the tough questions. Please keep them coming. You may not always like what I'm saying, but I will always be honest with you, and I will tell you what I believe to be the truth. So again, thank you for joining me tonight, and I look forward to seeing you again next Friday at 6 o'clock on Facebook. Enjoy, and please be safe, and have a wonderful weekend. Good night, everybody.